Hello everyone, I'm Gina, a nurse in the Administrative Management Department. Today, I would like to discuss safe sex and medical insights regarding pregnancy emergencies. In the past, most people avoided discussing topics related to sex. Whether it was about safe sexual practices or the nature of sex itself, a lack of knowledge led to many misconceptions and false beliefs, leaving individuals unsure of how to protect themselves. Sexual education and knowledge are no longer taboo. Understanding these concepts is essential for self-protection. Love is beautiful, but regardless of how long the relationship lasts, it's important for women to know how to protect themselves. Whether married or unmarried, adult or minor, unplanned pregnancies can catch anyone off guard and disrupt original life plans. The best way to avoid unplanned pregnancies is to take proper contraceptive measures, which is what is meant by safe sexual practices. Safe sexual behavior is not just about using condoms during intercourse, it also emphasizes the importance of establishing a genuine attitude of respect between genders. In relationships, in addition to building correct sexual concepts and mutual respect, the ABC principles should be adopted. A. Abstinence means avoiding sexual intercourse. If sexual activity occurs, then B. Be faithful, refers to having a fixed, monogamous partner and using C. Condom as a contraceptive method. A correct attitude leads to cautious behavior. Tracking the duration and length of one's menstrual period is important for women. By monitoring the length of the cycle, the amount of bleeding, and the color of the blood, individuals can gain insights into their health. Here's a free app that you can use to track your period. It automatically calculates your fertile days and predicts when your next period is due. If you do decide to engage in sexual activity, there are several legal and safe contraceptive methods available. These methods can be categorized into three main principles. Preventing implantation, this includes intrauterine devices, IUDs. Suppressing ovulation or avoiding ovulation days, this is achieved through oral contraceptives. Preventing the union of sperm and egg, this includes condoms, as well as male and female sterilization. It's important to note that none of these methods, except for male and female sterilization, guarantee 100% prevention of pregnancy. Next, let's briefly introduce several contraceptive methods. First, let's introduce condoms. The method of using condoms is one of the simplest and is the most commonly used form of contraception. During sexual activity, there is contact and exchange of bodily fluids, which can facilitate the transmission of viruses and bacteria. Therefore, it is very important to use condoms throughout the entire sexual encounter. Using condoms not only helps prevent pregnancy but is also the most effective method for preventing sexually transmitted infections, STIs, and HIV. Condoms are made of latex, which effectively blocks various pathogens and sperm, preventing even the smallest microorganisms from passing through. Nurse Gina advises that condoms should be used correctly and not reused to ensure effective contraception and protection against STIs. Next, let's introduce oral contraceptives, which can be broadly divided into two types, preemptive and emergency contraceptives. Their mechanisms of action are quite different. 1. Preemptive contraceptives. These pills work primarily by suppressing ovulation, thickening the uterine lining, and increasing the thickness of cervical mucus, making it difficult for sperm to swim and preventing fertilization. 2. Emergency contraceptives. These are high-dose hormonal medications designed to be taken shortly after unprotected intercourse. They aim to either delay or prevent ovulation, stop fertilization, or prevent a fertilized egg from implanting in the uterus. Nurse Gina advises that oral contraceptives are prescription medications and should only be taken under the guidance of a gynecologist. If you experience any adverse symptoms during use, such as nausea, mild vomiting, swelling, breast discomfort, or elevated blood pressure, it's important to consult a healthcare provider. Intrauterine device, IUD. The intrauterine device, IUD, is placed inside the uterus and is a safe, effective, simple, economical, and reversible method of contraception. The duration of effectiveness varies depending on the brand. The mechanism of the IUD involves introducing a foreign object into the uterus, which leads to a localized inflammatory response in the uterine lining. This triggers an immune reaction that destroys sperm and fertilized eggs, while also interfering with the implantation of a fertilized egg. Nurse Gina advises that it is crucial to have a professional evaluation by a gynecologist before the placement of an IUD. If you experience abdominal pain or vaginal bleeding during or after insertion, seek medical attention immediately. It is also recommended to have an annual checkup to confirm the position of the IUD. Male and female sterilization. Male and female sterilization is the only contraceptive method that can achieve 100% effectiveness in preventing pregnancy. The two procedures work on different principles. In males, sperm is produced in the testicles and matures in the epididymis. The sperm travels through the vas deferens to the seminal vesicles, where it combines with fluids from the prostate and bulbourethral glands to form semen. During ejaculation, the semen is pushed through the urethra. By intercepting the vas deferens, the sperm is prevented from being released, thereby achieving contraception. Female sterilization. In females, eggs are produced in the ovaries and released into the fallopian tubes during ovulation. Sperm can enter the uterus through the vagina, and if it meets an egg within 12 to 48 hours after ovulation, fertilization occurs in the fallopian tube. The fertilized egg then travels to the uterus to implant and grow. Female sterilization involves blocking or sealing the fallopian tubes, preventing the sperm from reaching the egg and stopping fertilization from occurring. Sexually transmitted diseases, STDs, are illnesses transmitted through sexual activity or contact. The modes of transmission include contact between the penis and vagina, penis and anus, or sexual organs and the mouth. Common STDs include HIV, AIDS, syphilis, gonorrhea, HPV, human papillomavirus, herpes, trichomoniasis, mycoplasma, chlamydia, and vaginitis, among others. These STDs are transmitted through unsafe sexual behavior. This means that if you engage in unprotected sex, you should be vigilant for signs of infection. The bacteria or viruses that cause STDs can only survive in the human body, and their incubation periods can vary widely, from a few days to months or even years. Symptoms are not always obvious, but if you experience genital pain, discomfort during urination, abnormal discharge, genital ulcers or rashes, or swollen lymph nodes, it is advisable to seek medical attention promptly. If you suspect you are pregnant, whether it's through a home pregnancy test or confirmed by a doctor via blood tests or ultrasound, and the obstetrician-gynecologist informs you that you are indeed pregnant, please inform your supervisor, HR, or a nurse immediately. The key is to notify us. The nurse Gina will arrange a consultation with you to confirm your pregnancy weeks, due date, and any discomfort you may be experiencing. Afterward, the occupational medicine doctor hired by the company will assist in evaluating whether adjustments to your work hours or environment are needed. This pregnancy was not planned, it was an unexpected pregnancy. Here are a few options for your consideration. The first option is to get married due to the pregnancy, the second is to give birth and raise the child yourself, the third is to place the child for adoption, meaning giving the child to someone else to care for, and the fourth option, after evaluation by an obstetrician-gynecologist, may involve ending the pregnancy through medication or surgery. Regardless of which option you choose, the process must be legal. If you choose to terminate the pregnancy, and during the medication process or after the surgery, you experienced severe abdominal pain, back pain, or heavy vaginal bleeding, please seek medical attention immediately to avoid missing the critical treatment window. Pregnant women not only need to take care of their own health, but also consider the well-being of their fetus. To ensure the health of both mother and baby, if you experience any discomfort, do not take it lightly. Seek medical attention when necessary. Don't wait for an outpatient appointment if you need to go to the emergency room. Let professional doctors assess the situation and provide the necessary treatment. Do not let negligence lead to regrettable outcomes. Now let's introduce 3 obstetric emergencies, also known as pregnancy emergencies, that require immediate medical attention. The first is threatened, spontaneous abortion. This refers to signs of abortion, such as bleeding and abdominal pain, occurring within the first 20 weeks of pregnancy. Common symptoms include light vaginal bleeding, especially brown discharge, which is often overlooked, severe lower back pain, persistent lower abdominal pain, and a feeling of pressure in the lower abdomen. If you experience any of these symptoms, please seek medical help immediately to have your baby's condition checked. Nurse Gina's advises, experiencing these abortion signs does not necessarily mean an abortion will occur. It is still essential to consult a doctor to confirm the baby's health. Ectopic pregnancy. Under normal circumstances, the embryo should implant and develop within the uterus. If the embryo implants outside the uterus, it is called an ectopic pregnancy. Common symptoms include abdominal pain, pelvic pain, light vaginal bleeding, dizziness, nausea, shoulder and neck pain, frequent urination, abdominal bloating, and signs of pregnancy. However, these symptoms can resemble those of gastrointestinal or urinary tract issues, which can lead to them being overlooked. If an ectopic pregnancy exceeds 8 weeks, the enlarged embryo can cause a rupture at the implantation site, leading to significant vaginal bleeding. This is a critical emergency that requires immediate treatment to stop the bleeding, otherwise, it can endanger the mother's life. Nurse Gina's advises, the symptoms of ectopic pregnancy often resemble gastrointestinal or urinary tract problems, which may lead to neglect or delayed diagnosis. It is advisable to keep track of your menstrual cycle and seek further treatment in obstetrics if you experience lower abdominal discomfort. Preeclampsia, eclampsia. Preeclampsia, also known as pregnancy-induced hypertension, refers to the onset of high blood pressure after 20 weeks of pregnancy, accompanied by proteinuria or edema. The main symptoms include high blood pressure, over 140/90 mmHg, excess protein in urine, low platelet count, declining kidney function, and pulmonary edema. In severe cases, liver and kidney function, platelet levels, and even the lives of both the mother and fetus may be at risk. Statistics show that the incidence of preeclampsia in Taiwan is about 2% to 8%, and it has been one of the top 3 causes of maternal mortality from 2016 to 2022. Therefore, it is crucial to control weight and regularly monitor blood pressure during pregnancy. Nurse Gina's advice. If you experience abnormal bleeding, abdominal pain, or back pain during pregnancy, please seek medical attention immediately to confirm the status of the embryo or fetus. Lastly, here are the 5 do's and 5 don'ts during pregnancy. 5 do's. Attend prenatal checkups on time. Be aware of the signs of preterm labor. Maintain good prenatal care. Identify high-risk pregnancies. Know the signs of labor. 5 don'ts. Do not smoke or drink alcohol. Avoid exposure to secondhand smoke. Do not take medication without consulting your doctor. Do not use illegal drugs. Avoid scheduling a cesarean section at an inappropriate time. If you are unsure about any medication prescribed during pregnancy, you can ask your obstetrician at the moment or bring the medication bag to Nurse Gina for clarification. Thank you for listening.